I'm hearing from some members of the audience about, I'm going to mangle how you pronounce this, ivermectin, which is, I think, a deworming treatment for horses. You can tell us. I know it's been disproven. The studies it's based on were retracted, but I'm talking to so many people who are convinced that they know someone this helped. And at the same time, I'm hearing reports that people are taking these pills and getting hospitalized because of the pill, not from COVID. Can you tell us, what is this ivermectin and why shouldn't people take it?
Thanks for raising that, Jessica. So ivermectin is, as you say, it's an anti-parasitic drug. So it's something that you give animals or even pets like dogs at home. You give it to them if they look like they're having diarrhea, frankly, from a tapeworm in their gut, just to be blunt about the purpose of it. So it's pretty raw, the reasons for it, and they're pretty constrained. These are veterinary type drugs. Sometimes humans get them if they happen to have tapeworms, but those indications generally are for people that live near the equator. Rarely is ivermectin utilized for humans in the United States because these types of tapeworms don't tend to affect humans often. I'm not saying it isn't possible, but often in the US. Why is this a big deal in studying COVID? Well, some people have studied, does this drug in any way kill or neutralize COVID-19 in studies, in Petri dish studies. And they found out that in Petri dish studies, when you're actually putting the coronavirus next to ivermectin in a Petri dish, it kills it off. And so now people have made the judgment, well, then why not try it in the human body? And so now people are doing that. The problem here, Jessica, is that the dose that one would need of ivermectin to kill coronavirus in the body is in some cases 600 times higher than the dose that's being utilized in the Petri dish. And so that's why these people are coming in with liver injury, kidney injury, and they're dying in some cases as a result of toxic levels of exposure to ivermectin without any clear proof that this drug works inside the body. What happens in a Petri dish does not necessarily apply to what happens to the body. So number one, there's no proof in a randomized controlled trial that ivermectin is actually beneficial to those with COVID. And number two, it's really darn toxic at the doses we think you might need for it to show any benefit. So that's why for all of you out there, please do not take ivermectin. I have personally cared for people who come in with liver injury who thought ivermectin was a good idea because their doc told them it was. There's a lot of doctors out there, frankly, that need to be held accountable in the US and elsewhere for blindly prescribing something that has no NIH oversight, no FDA guidance, and no randomized clinical control, no randomized controlled trial data behind it. It is irresponsible that people are doing this because people are harming themselves on the advice of other doctors.
Hi, I'm Jessica Yellin. If you like this video, please click subscribe, and you can click the bell to get notifications when we post new content. Thanks for watching.